Continue with our first aid lesson, and so far we have learned a lot concerning first aid, and we talked about nose bleeding. And since we've already talked about it, I'll just pose it as a question. What should you do if you encounter someone with the nose bleeding? What did we say we should do?
What did we say we should do? Someone should demonstrate.
Yes, Felian.
The head should be tilted downwards.
Mm-hmm.
Then you apply pressure by pinching the area around the nose.
Yes. So you tell the patient to sit down uprightly, then you tell them to lean forward, then you pinch this part of the nose, the soft part.
So tulisema bony part. Ni bony.
Yes, a soft part. Yes, so you pinch that soft part and you tell that person to hold it for about 10 to 15 minutes without stopping. You are not supposed to be stopping now and again checking if the bleeding has stopped. Supposed to hold it that way, then you breathe with your mouth. Yeah. Yes? Yes, a question?
Naonanga watu wanamwagiwa maji kwa kichwa. Yes, ametilt kichwa na anapinch but naonanga na maji anamwagiwa maji kwa kichwa.
Yes, Brian.
You know, kitu na hiyo shida now and then. So kuna mtu mwingine amini kama hiyo kitu na watu unachukua mayai unakoroga na nini?
Yes.
Lemon. Ndio unaikoroga unapasua yai, lemon unaweka hapo ndani unakoroga hadi inakuwa inaelewana vizuri. Unaikoroga hadi inakuwa inaingiana vizuri.
Yes.
Then unamweka position until the backward, the head backward, and unamwangia kidogo kwa mapua, ingine anakunywa. Inapotea. It happened with my sister. It has never been.
Like it was a one-time thing and it was never.
But I want you bleeding now.
Okay.
Eti mayai na lemon unamwagia kwa mapua.
Kidogo tu ingine unampea na.
So you go research about that maybe.
Yai moja na ndizi moja. So na ilifanya hajaipata hajailisha.
So maybe you go and research, we understand the mechanism. How does it work? So that was nose bleeding, yes?
Not like you are like the cells behind nose bleeding. Like you mean that
Nose bleeding. Probably they are arteries.
The pressure outside and the pressure inside does the match.
Okay.
So in a lead to rupture of
the arteries. Capillaries. Okay, capillaries.
Yeah, the nose.
So when there is an imbalance in pressure outside and inside, leading to rupture of blood vessels in the nasal cavity, in the nose.
Also not necessarily pressure alone. Trauma. Pigwa ngumi kiamua utafanya nini. Also another thing is infection. Infections, homa inakuwa nini. Even they could have conditions like pressure, high blood pressure. It can cause the vessels to rupture. Another thing is bleeding disorders. DIC, disseminated intravascular coagulopathy.
Yes.
Such like nini, it can cause frequent nose bleeding.
Thank you. So there are many factors that may cause that nose bleeding. And we have talked about how we will manage. We also talked about things that you ought to avoid. We said you are not supposed to lean backward because you are risking the blood to go to your throat or even you swallowing that blood. You are not also supposed to blow the nose immediately afterward. And this we have said you are not supposed to repeatedly release pressure on your nose. If you have said it is for about 10 to 15 minutes, you hold it for those 10 to 15 minutes. Don't release it now and again. So that is nose bleeding. I will talk about wounds. Wounds. And what is a wound? So a wound is a disruption or an injury to normal continuity of the skin or the underlying tissue. That is a wound. It is a disruption or an injury to normal continuity of the skin or the deeper tissues. And wounds can come in many ways. You can have incisions. For example, when you cut with a knife, it is a regular a cut. That is an incision. When you have a cut and it's not regular, it's called a laceration. Then you can have abrasion. Abrasion is when the surface of your skin is kind of removed. For example, when you fall on a motorbike, you may be abrased. Then there is penetrating wounds. For example, when you are stabbed by a knife, of course, that is a penetrating wound. So wounds can cause bleeding. And of course, now you go back to how do you manage bleeding. So can cause bleeding and provide an entry point for microorganisms, potentially resulting in infection. So you are trying to prevent these two things. One, to prevent bleeding, and number two, to prevent entry of microorganisms. So what do you think should one do when you encounter somebody has a wound and the wound maybe it is bleeding? What is the first thing to do? Apply pressure. Yes, yes,
Stop the bleeding by applying pressure.
yes. So you stop the bleeding first. Then if possible you can, yes, Felian.
So in a case someone was stabbed, maybe a piece of glass, maybe you're not supposed to use the object.
Yes,
Yes, okay.
yes. So for penetrating wounds, like somebody has been stabbed, it is good, it is advisable for you to leave that piece. Maybe it's a knife or a glass, because if you remove it, you are risking that person to bleed. Maybe even a major artery has been injured, so you leave it that place. What else should we do? We have said you should stop the bleeding. What else should you do to a wound?
Clean.
Yes, clean. We're normally told the solution to pollution is dilution. So you use water. You use water and try as much to clean it. Clean the wound. So you clean the wound, you clean the surrounding skin, and you can remove only easily accessible superficial debris as you are cleaning. Then after cleaning, what do? You cover the wound. You cover the wound and ensure that you are using a clean and dry dressing. Then if the wound is maybe deep, or if it was a penetrating wound, like now somebody was stabbed, you can take them now to hospital in that case. But if it was a minor wound, a minor injury, after you've cleaned, you've dressed the wound, then I think it can heal. Yes, it will heal easily. So that was all about wounds. Wounds. Any question or addition concerning wounds?
Are we allowed to place things like the charcoal, cayenne on wounds?
Yes, that is the question. Are we allowed?
Maybe umekata na kisu, unaambia weka chumvi.
Are we allowed to put those things on wounds? For example, salt. Actually, people normally put salt. I don't know what is the mechanism. Yes, it works. But what is the mechanism?
Gari.
Garlic, yes.
Jina la kando.
Inasaidia kufanya nini? I think the point is the same of kuapply pressure kusaidia damu kunini, because why would they be
No,
They
salt,
work.
salt
Work.
can disinfectant.
It works.
yeah, maybe for salt.
I think some things have been scientifically proven to have healing characteristics. For example, activated charcoal, it traps the dirt. To therefore reduce infection, make the wound clean. The more, you see, the way, the moment a wound is clean, healing is imminent and it will be expedited. And then another thing, things like garlic, for the same reason. Garlic, we know it is an antibacterial. It removes it has antibacterial properties, and it also has some nutrients as well. They get absorbed into the skin to promote healing. So I think I don't see any harm with doing. For salt sometimes it causes dehydration because it makes you have water. So I don't know
Unaponya kwa first aid.
Mi
Unatumia hiyo kitu.
mi sipendanga uji. Ilikuwa tu Tuesday, so
Mimi nilipata deep cut hapa. Niliweka chumvi but bado ilikuwa na bleed sana. Hata tunakula hiyo pressure hiyo.
kama haubleed basi mi siko na
Hauko na bleed.
Sawa. So you go and research maybe on that salt. But we've seen activated charcoal and garlic, they work.
But
Because
sasa,
charcoal, yes?
but you also don't just apply activated charcoal directly to the skin.
Yes. What do you do?
Unafaa kuitumia ka poultice kwa wound. Na kama ni garlic, una irrigate na garlic water. Let's say you're doing dressing. Sasa hapo ndio I was thinking, hapo ni kwa management. That's why you can use maybe garlic water na activated charcoal poultice ama hiyo saline water. Unaona? But sasa kwa first aid kuna watu wenye tu umekatwa, shaweka kitu hapo tayari.
after cleaning hiyo ndio kitu naye kama unavaa nini before ukava.
Uweke ukava, uweke hapo wote.
Before you cover the wound, what are you doing after you clean the wound? Before you cover it, ama una clean tu na unaikava hivyo.
Peleka mtu wote. But anyway, sasa hapa tunatry kuongelea before, let's say tuko na sanitarium. Na tutamanage hiyo.
Just back. Really, other things.
Yes. Sawa. So you can just clean. You remember we said first aid, you use the available resources. Sorry. So we said first aid, you use the available resources. So I believe water is quite available. You can use water and you use a piece of cloth. You tie it. So that is about wounds. We are going to talk about sprains and strains. Sprains and strains. So what is a sprain? Yes, so sprain is an injury to a ligament. Yes, usually caused by excessive stretching or tearing. The ligament can have teared maybe partially. So that is a sprain, injury to a ligament. For example, injury to sprain, S-P-R-A-I-N. So that is sprain, injury to a ligament. For example, injury to ligaments around your knee, the collateral ligaments around your knee. probably due to excessive stretching or tearing. Now a strain is an injury to a muscle or tendon, and it is also caused by excessive stretching or tearing. So that is a strain. For example, injury to Achilles tendon or Achilles tendon in your ankle. So of course both may produce pain, swelling and reduced function. What do you think are the first aid measures for sprain and strain?
Applying ice pack.
Ice packs. Yes, that is part of it because that cold will reduce pain. So that is one way. So what you do, of course, you protect the injured area from further injury. Then you tell the person to rest. Tell the person to rest. If the person maybe has been injured, the Achilles tendon has been injured, you encourage them to rest, not to walk up and down. It will be good if the person will rest. Then you do cold therapy, what you've been told here. So you can apply a wrapped cold pack for short periods, and this helps to reduce pain and swelling. Then there is also elevation. You can elevate that part that has been affected. There is that elevation. I think that is all. Anybody to add on anything on sprains and strains or a question?
Strain your muscle.
Eh?
Strain your muscle.
Muscle pull is quite different.
The muscle.
Yeah, muscle or tendon.
Or tendon.
But muscle pull, yeah.
Muscle pull is not necessarily an injury. Tulisema ni kama
That's circulation. Yeah, Nairobi circulation. So kumaanisha oxygen
no, pia inaweza sababishwa na ile hiyo overstretching ama pia uncontrolled inaitwaje hizo hiyo hakuna proper coordination between ya movement, so it's either kuna rapid contractions
unapata tunafanya zoezi for some time, akifanya zoezi kidogo nafika na muscle. Lakini inaweza kuwa hiyo ya
Thank you. So that was all about sprains and strains. And I also saw that you are supposed to compress. And I wanted to ask, why should you compress? Maybe somebody knows the reason. Could you know the reason why we ought to compress? We have said you should rest. You can do a cold therapy, apply cold packs. We have also said you can elevate that part. And there was also compression. Now, I didn't understand here, but you can go and look at it.
also for sprain. There's something like massage or hiyo wewe tunaifanya wrongly. Assuming someone had a sprain, most of the time we try like umesema kwa like most of the time you try kama you're trying to flex the area kama ni mkono kwa I don't know, are we doing it wrongly? Kama tutaangalia.
Taangalia. So that
does work. You brilliant these things that everything. hata hiyo kunini huwa sometimes like unaona hiyo mkono after sometimes inakuwa moto.
But tendo nikirapture huwa ina take hata a whole year ndio mtu
Actually si anafaa kufanyiwa surgery.
Yeah.
Tendo ni kirapture. Hata ligament. Yeah. So that was about sprains and strains. So we'll talk about seizures or epilepsy. Seizures.
Maybe before we go to that,
Yes.
how will you know? How will you differentiate a sprain from a sprain? If someone like got injured, how would you differentiate?
A sprain from a strain.
Yeah.
So we have
Maybe
seen.
someone is playing football ameumizwa. How can we differentiate like this is a sprain, this is a nini? Ama their management is the same.
Yeah, their management is the same. And you know it can become difficult because you can have tendons and ligaments around the same region, but their management is the same. Yes. So we'll talk about seizures. And what are seizures? Seizures is a sudden episode of abnormal electrical activity in the brain that may cause change in consciousness, sensation, behavior, or muscle activity. So it happens when there is an abnormal electrical activity in the brain, when there is an imbalance of those chemicals in your brain, they will cause seizures or epilepsy. And these changes brings changes in consciousness, sensation, behavior, or muscle activity. And I believe most, if not all of us, have seen a person who is epileptic, who's is going through that episode of epilepsy. What have you observed from a person in that episode of epilepsy? What have you observed?
like action, yeah.
Muscle rigidity. Inakwanga tremors. Oh,
There is that muscle, involuntary movement of muscles. Yes, they move uncontrollably. That is one of the signs. They can also lose consciousness. There is that rhythmic jerking of which you have said. There can also be loss of bladder control. And of course, there is confusion after seizure. There may be confusion after seizure. So what are the first aid measures? When you observe that person, what did you do for that person to come normal again?
For the first time, or for the known of
hata kama ni known, kwenye unapatana na yeye. Yeah.
Yes, Moses, you had something. Yes, ensure safety of the person. If kama kuna anything yenye inaweza muumiza, unaweka kando, si ndio? Yes, what else? That was on safety.
Naona hiyo tu ndio naweza msaidia. Lazima kitu msaidia. Si ni episode inakuja na inapita. Yeah, kuna hiyo.
Yes. So you also cushion the head. Now you cushion the head.
You also
And
remove tight clothing.
yes, tight
and
clothing.
then remove any object in the airway.
Yes.
And then place the patient in a recovery position.
Yes. So you're not supposed to restrain the person. Hufai kumshikilia mpaka nyamaze. It's not good. You just leave him. You allow the seizure to finish naturally. So after the seizure, you are supposed to check breathing. Is this person breathing normally? And then you place them in recovery position as you've been told. Then you stay with them until they recover. We have said there may be confusion after seizure. So you stay with them until they are fully recovered. And there are instances when you need to seek emergency. What do you think are some of these instances? Normally a seizure should last, I think, about 5 minutes. So if it goes on, it is not stopping, it goes on, I think you need to seek now medical emergency. And again, if the person has difficulty breathing afterward, and also if there is a serious injury that occurs, you may be needed to seek a medical emergency. So that is about seizures. And there are many myths. There is this one that I heard that ukishikwa na seizures unatafutiwa kiatu. I don't know if you have heard kiatu inanuka vibaya, unawekewa kwa mapua, then it is misleading. Ama inafanya brayo, you know, yako imekuwa ikifanya. Hiyo umeona? Oh. So there are a lot of myths and misconceptions.
Na kuna wamama wa Giriama wanakemea mapepo. So how do you know this is a seizure? Because seizures here they present similarly to demon possession.
Yeah.
Now that you are a Christian, Hebby, now that you are a Christian and are done how do you distinguish between seizures and demon possession? So they almost present the same way.
Number one, kama ni epilepsy, we utapata most of the time ni known unless it's secondary to an injury ama trauma to the brain, ndio mtu alipata accident affect brain, ndio after that episode akaanza kupata hizo seizures. But sasa umekaa tu vizuri tu hivi from nowhere. And another thing, it's the same rhythmic jerking of the nini, wanaongea wanatoa vitu kwa mdomo.
Neno nyako demon possess. Wengine huongea. Walisemanga mashindano ya kuendelea.
Mama anapiga nduru nini.
Mtoko
Epileptic
So we said when you start you pray.
Start from the scripture, even before we come. Maombi, kwani maombi itakuwa imefanya dhambi?
That is the issue. Because we also had an incident. There was a child we were trying to know whether the problem was epileptic ama it was seizures, and we had a difficult time because we went even to the hospital. They have done CT scan. CT scan inakuja negative. Wamefanya EEG negative. And then akona hizo episode. Do you assume this is still epileptic? Ama this is something else? Now we could now not tell. It is something that has been reoccurring. And the child is like 10 years or something. Of course, they are not talking during that episode.
Yeah.
It's something that has happened. So we never knew where to direct our energy. Is it medical problem or it is a spiritual battle?
Ndipo ilikuwa imeanza kwa 10 years.
Yeah. Ilikuwa imeanza, it has been going on for some few months. Like 3 months or something.
Na hakuna kwa history taking, hakuna anything which like substantially leading to those episodes.
Nothing medical. Just speculation. They did all the tests, like human anxieties, whatever.
Yeah, also there are things which cause seizures. There's infections. Yeah, infections, ama hypoglycemia.
Hata hypertension.
Febrile convulsion.
Especially in children.
Sawa. So that was about seizures. We'll move on to poisoning. Poisoning. And now poisoning, it occurs when harmful substance enters the body and produces toxic effects. When a harmful substance enters the body, producing toxic effects. For example, we had a patient who died because of inhaling, it was petrol fumes. Yeah. So that was kind of poisoning. A harmful substance entered into the body causing harmful effects. Now poison can enter into the body through many ways. We have swallowing, inhalation, skin absorption, eye exposure, and even injection. So what do you think are the first aid measures for somebody who has been poisoned? For example, has eaten something that had poison. Or you had a question?
Like what to like to give like suggestions of the poison, like
Yes,
science ataonyesha.
signs.
Like yenye ukimwona utaweza test hiyo poison.
What could be the signs of poisoning?
Depending with the poison, kama ni mtu amekunywa ama food walikula, number one, loss of consciousness and delayed activity and response. Kama ni kitu alikula, most of the time, kama mtu atashika tumbo, akilia, foaming.
Well, maybe alisema fingers.
Yeah.
They turn blue.
Especially kuna plant zenye ilikuwa inaitwaje? Nimesahau hiyo jina, but kuna plant fulani yenye watoto most people wana confuse na managu, na huwa ina grow kwa fence, iko na purple leaves. So ukipata kama hiyo watoto wakikula fingers zinatana
Blue.
inaitwaje? Sawa, nitakumbuka. Ni
Haya.
very common huko Kisii. We used to treat it every other time.
Okay.
Nitakumbuka Arusha.
So those are some of the signs. Probably kama amekula kitu mbaya.
Diarrhea,
Yes.
vomiting. The body
Yes.
also tries to eject whatever is left.
So what should you do to a person who has been poisoned? For example, has eaten something, yes?
Poison are we talking about? Even alcohol. Is alcohol poison? There's organophosphate.
Yeah.
Alcohol. So we need to try to cover that because this can be like that. We need alcohol, normally organophosphate.
Tunaweza anza na organophosphate.
Yes. Brayo, you were to tell us some.
Okay? Naulizia tu Swahili.
Okay.
Naulizia
Okay, what are the general principles then of dealing with poisoning?
Any road.
Yes, that is.
Respirator. Itakuwa respirator.
Number one, unaweza cause aspiration. Number two, you're not sure of the chemical walikunywa. So zingine ni corrosive. The moment you vomiting, you're doing more damage to the unit. Yeah. Don't force it. Don't